Hi, it's Christina with the Sisyphean Journal, and today is August 3rd, and I've already done videos commemorating the 3 death anniversaries that we have today. I'm going to link to those below. Today I'm going to cover Kermit Gosnell a little bit more, and I've already linked to the introduction to the grand jury report, what Gosnell did to the babies, and I'm talking about born babies, not unborn babies. I'm talking about babies that you could take down to the hospital and they would have survived. Instead, he took surgical scissors and went and severed their spines to kill them, and what he did to the mothers and how he was able to get away with it. And how he was able to get away with it was basically what's called regulatory capture. There are other things that you can't talk about on YouTube going on where regulatory capture has really come to the forefront. There's a lot of talk about it, and I don't want to risk this particular video by discussing the regulatory capture related to pharmaceutical companies. So basically what happens with regulatory capture is that an industry gets people into key positions so that they can just do whatever the heck they please. The bureaucrats are part of their team. Well, we're going to move on now to Section 3, Gosnell's illegal practice. Again, this is the grand jury report. Gosnell's medical practice was not set up to treat or help patients. His aim was not to give women control over their bodies and their lives. That does not exactly make him conspicuous for his lonesomeness. This is, if you follow the blog, if you follow this channel, you'll see that's pretty much par for the course. Again, that's the distinction between pro-choice people and the abortion lobby. The abortion lobby is there to give abortion practitioners control over their own lives. And if what they want to do is what Gosnell did, then so be it. He was not serving the community. Gosnell ran a criminal enterprise motivated by greed. Some 40,000 abortions are performed across the Commonwealth each year. Abortion is normally one of the simplest and safest medical procedures. Pro-lifers are going to get upset about me saying this, but abortion cannot be inherently extraordinarily risky, because if it was, there would be a lot more than 2 dead women on Gosnell's doorstep. Although, of course, you might attribute the comparative lack of dead women to the quality of medical care that they get afterward. But still, it must be relatively hard to kill a woman if what Gosnell did wasn't leaving dozens of them dead. Not in Gosnell's clinic. Employing unlicensed, untrained workers in a facility that was grossly inadequate and unsanitary, his operation made a pretext of providing health care. Again, you follow the channel and the blog. Gosnell was a difference of degree. It was pretty bad. I've seen some dirty clinics, but Gosnell's takes the cake. And most of the clinics that have untrained and unqualified workers, they're at least high school graduates. In the absence of any regulatory oversight, Gosnell recklessly cut corners, allowed patients to choose their medication based on ability to pay, and provided abysmal care, all to maximize his profit. We estimate that Gosnell took in as much as $10,000 to $15,000 a night, mostly cash, for a few hours of work performing abortions. And this amount does not include the money he made as one of the top OxyContin prescribers in the state. And that $10,000 to $15,000, some of these 3rd trimester abortions that are done, oh my gosh, I think it's Arizona, where you can be out of state and the abortion clinic will get you onto the state's medical insurance so that the taxpayers will pay $10,000 or more for a 3rd trimester abortion. So there are some doctors who are, making the same kind of money Gosnell was making with about as much work. The Women's Medical Society stands as a monument to the absolute disdain for the health and safety of women, and in many cases of babies who were born alive in this filthy clinic. The deaths of women and of countless viable babies was a direct and foreseeable consequence of the reckless and illegal manner in which Gosnell operated his clinic. Employees at the Women's Medical Society who testified before the grand jury were not surprised when a lethal overdose of drugs killed one of Gosnell's patients in November 2009. They had seen many close calls and at least one other patient's death caused by Gosnell's careless and criminal practices. And that reminds me of Scott Barrett and the death of Stacy Ruckman. Let me make a note. So I include a link to that. Ruckman didn't want to have a qualified person on staff to oversee anesthesia, but he wanted his patients unconscious for the abortions. So he would overdose them with lidocaine, and they'd lose consciousness. And sometimes they stopped breathing, but he'd always been able to revive them until the unfortunate Stacy came along, and they weren't able to revive her. So again, Gosnell isn't... He's not a two-headed snake. He's not that unusual. Again, it's a matter of degree. They knew that Gosnell chose unlicensed, untrained, and unsupervised workers to anesthetize his abortion patients, and that the drugs, in accordance with his office procedure, were administered in the doctor's absence. None of Gosnell's employees were licensed or properly trained. Gosnell's staff warned him that two of his employees, Linda Williams and Sherry West, Gosnell's staff warned him that two of his employees, Linda Williams and Sherry West, were not only unlicensed and unqualified, but sloppy and unconcerned as well. They presented an obvious danger to the clinic's patients, whom they routinely over-medicated and failed to monitor. But while Williams and West were perhaps slightly more careless than other workers, their actions were consistent with the corner-cutting practice that Gosnell had operated for decades. Every aspect of that practice reflected an utter disregard for the health and safety of his patients, a cruel lack of respect for their dignity, and an arrogant belief that he could forever get away with the slovenly and careless treatment of the women who came to his clinic. And, well, you get away with it for 18 years, you kind of assume you're going to get away with it for 19, 20, 21, 22. The only thing Gosnell seemed to care about was the cash he raked in from his illegal operation. The fact that the doctor staffed his facility with unlicensed and indifferent workers and let them practice medicine unsupervised was only one factor that made his clinic such a dangerous place for his patients. Dirty facilities, unsanitary instruments, an absence of functioning monitoring and resuscitation equipment, the use of cheap but dangerous drugs, illegal procedures, and inadequate emergency access for when things inevitably went wrong, all put patients at grave risk every day. And again, these are things that, I've got a whole playlist for inadequately trained, filthy, sloppiness with anesthesia. When two of Gosnell's staff members sought abortions, they knew better than to go to him. They went to other clinics where they marveled that physicians actually counseled patients, the facilities appeared sanitary, and a doctor was in the room when they were medicated. Mrs. Mongar was just one of many patients victimized by Gosnell's depravity. There were scores more. At least one other mother died following an abortion in which Gosnell punctured her uterus and then sent her home. And I need to point out that Karnamaya Mongar and Shamika Shah are the dead women we know about. It's entirely possible, indeed probably pretty likely, that other women died and their families never sued. Nobody ever complained. They just accepted it. You realize Karnamaya Mongar was a refugee. Her death only came to anybody's attention because of the raid. But you can imagine, other uneducated women, poor women, women who are used to just being beaten down by life. They're probably, most of them, not in families that feel like justice is anything within their reach, so they're not going to even go for it. It really would be interesting to know how many dead Gosnell really did have. He left an arm and a leg of a partially aborted fetus in the womb of another woman, par for the course at abortion clinics, and told her he did not need to see her when she became sick 6 days later, having developed a temperature of 106 degrees. He perforated bowels, cervixes, and uteruses. He left women sterile. He also killed live, viable, moving, breathing, crying babies. He killed them by cutting their spinal cords after their mothers had delivered them after receiving excessive amounts of medication designed to induce active labor. This report documents multiple murders of viable babies. The evidence makes a compelling case that many others were also murdered. Gosnell and his employees performed abortions long after the legal limit. The doctor's unorthodox methods, especially with late second trimester and third trimester pregnancies, virtually mandated the premature delivery of live babies, whose spinal cords he would then routinely slit. These practices persisted for many years without interruption by any regulatory body. The pain, suffering, and death that he and his employees perpetrated were not the result of accidentally botched procedures. It was Gosnell's standard business practice to slay viable babies. The women who died or whose health he recklessly endangered or irreparably harmed were simply collateral damage for the doctor's corrupt and criminal enterprise.